So just like most places in the United States, heart disease is our leading cause of death here in Porter County.
We received an email that said if you write a grant, you can get a HeartCore member that can come out and help in the rural communities. And because we're located very centrally and we have lots on the outskirts, we weren't able to get out there.
I was in the medical field, in the cardiac field, and I wanted to kind of stay in the same realm. So I was searching cardiac and heart online, and HeartCore popped up. I saw that it was community-based, so I was really excited to get out into the community and do more prevention instead of treatment like I have been doing.
If you know farmers, they don't go to the doctor until they need to be at the doctor. They're going straight to the ER. So if you're able to get them out while they're taking their break or working and check them there, I mean, they don't have to get to that drastic point of, now I've got to go to the ER.
I was tabling at the library, doing some blood pressure screenings there, and we had a couple come in. Their blood pressure ended up being really, really high.
So she, of course, had them sit down, take a couple deep breaths, and then remeasured. And it was still high. She did it a third time. So she explained to them, this is really, really bad.
So we talked about their options from this point forward: physical activity changes, dieting changes, stress relief.
And she was able to get that at a library, someplace that as a health department we would have never been.
So it really expanded our outreach into the community, particularly education on blood pressure, nutrition, exercise, and how they affect heart health.
HeartCore helped me understand what public health is by tons and tons of trainings, interacting with my other HeartCore peers, having all the amazing people at my host site teach me every aspect of public health.
Tara came to us and she was ready to hit the ground running. She had appointments and was meeting with people and was taking blood pressures the first week that she was in-house here.
When Tara's term with the HeartCore wrapped up, I was so impressed with the amount of people that she was able to connect with, the amount of partnerships that she created. I just thought that that is what our health department needs. I went to my boss, Carrie, and I said, Tara's term is gonna end in about a month, and I want her to come on to be full-time. And Carrie said, absolutely, 100%. What can I do to help you? And then when I approached Tara, I'm like, Tara, I think you're amazing. You've done a wonderful job. Do you want to come and work for me? And she said, yes, I do.
I think it was really important for me to join HeartCore because I never knew that I could get a position like this in public health. Being in HeartCore gave me the confidence that I needed to really get out there and make connections and realize that I can do some stuff like this.
When it came time for Tara's review, I wanted to share what an impact she had had with us and make sure that the people that were supervising her at the HeartCore knew how amazing she was and what an all-around great person she was. I mean, she's made a very giant impact on the department. I would say that she's made an even bigger impact on the public.